there, this is Ginger Bratzel of New Patient Attraction Automation and gingerbratzel.com, and this is the place to help you attract and retain more of your ideal patients, increase your production, and create sustainable growth for your practice. And today I'm going to talk to you about a strategy for filling up that hygiene schedule. Now, other videos I've talked about hygiene reactivation, things like that, on how to do it. Well, I'm going to give you a tip on getting some results on it. So I talk about doing this as a system. It has to go on a consistent basis. It's happened on a monthly basis for people who are past due. But I want to also add a part of that system. I really believe for hygiene, you can't send just a text out and say, hey, you haven't been in to get your teeth cleaned, because it has no meaning to them. They need a human voice, a really loving, caring voice. So in our practice, and what I recommend to our clients too, is doing a hygiene reactivation is by doing it in its off hours. And what I mean by that, we'll do it in the evening hours. It doesn't happen every week. It usually happens maybe once a month, where we had a team member who wanted to earn some extra money, and I'll tell you how they get that extra money. Would take home the list of people with the phone numbers, with their home and cell numbers, and call them in the evenings. Because at work, they got the deadline, they got the boss, the website's down, all kinds of stuff like that. There's still hectic stuff at home. You know, you're cooking, the kids, you know, just got home, but they're in a different mentality because they're on their time. They're not on the boss's time. So that's why it's more effective to call them at home on the evening hours. So we would call and get them scheduled. So the person would have a folder. They'd take everyone that was past due with their information, what they needed to come in. And then this was back in the days when, before you could even hook up to your computer, they would physically print out the schedule for like the next 2 weeks and take it home and write it in, and then when they bring it in the next morning, they transpose it and put it, the data's in there so nobody double books. So they printed the schedule last thing of the day, and then first thing in the morning the following day they put it back in there. So how do we get team members to do this? And how did I actually have team members fighting for this? And how did I get team members motivated to do this? Well, I gave them the option. I could pay them their hourly rate if that's what they're getting paid for doing that, or I can give them a bonus incentive commission. And how they got to choose. And I'll tell you, they always chose the bonus. With the bonus system, they called, and if they got somebody scheduled, they got $20 for that person. Now, to collect on the $20, they had to track it themselves. They kept track of everyone they got scheduled, and they presented that to me before we did payroll the next time, and we added that on as a bonus. Also, the person had to physically show up for the appointment. So what does that do? It makes a team member more involved. They're not just putting names in slots. They're going to really motivate these people. They're going to stir the pot and make sure that they know they need to come in for that appointment. And so they're going to make them involved and take ownership of the situation, just like you do, because when you make an appointment, that's your time. Well, all of a sudden, that's their time too, because it's their paycheck, and they like that. So let's say, for instance, they got a family of 3. They talked to someone for 4 minutes. That's $60 they made in 4 minutes to get that scheduled. That's pretty easy. That's shooting fish in a barrel kind of things. So that is very, very effective to getting teams motivated to do it, and then also better about getting your hygiene schedule. Because to me, hygiene is a priority, and it kept the hygiene room full. It automatically kept the restorative room full. So that I didn't have to fill 2 birds with, or I did fill 2 birds with 1 stone. I wasn't filling 2 different things. It always worked for me because they came from hygiene, they're going to go over to my restorative side, and it made me a lot more effective. So that's one of the strategies to help you get more people in, help your team earn some extra money. We actually had a person that had temped in our office that we really liked. She did this on the side. We had the office cell phone. She would take and call from that in the evenings and to the list. So if they got that number, they could call back to it. And she earned money for doing that. It was a stay-at-home mom, and that was really great for her, and she liked to do it. So the team members didn't want it. We had somebody to do that through. That's another strategy to do it. But it has to be a really fun person, really energetic, and someone with great follow-through, and it's really effective for you, and it's a great opportunity for them. Well, before I go, I have to tell you about one other fantastic thing. Prosper in Your Practice 2014 Live. It's coming back. If you didn't attend last year, you missed out. And if you did, you got to make sure you're at this one too, because I've added a whole bunch of new material to this event about exploding your practice, increasing and retaining more patients. We're going to talk about reactivation in a new way, getting more referrals out of patients. I mean, there's too much to talk about in just this video. So do yourself a favor right now. Go over to prosperinyourpractice.com and check it out. The dates are September 26th through the 28th in Dallas. I have a dedicated bonus massive action day for you, particularly on getting rapid results for your office when you go back. So You got to go over there. I will see you on the next video, and I will also see you in Dallas in September. Can't wait to talk to you live. Bye-bye.